Same-sex marriage is being legalized in a growing number of jurisdictions, and a growing number of lesbian and gay couples are having children. Today on Family Matters, we take a realistic look at same-sex parenting. Whatever your views may be about same-sex marriage, the reality is that more and more same-sex couples are becoming parents whether or not they get married. How do same-sex couples become parents? Do these couples and their children face challenges that don't exist for other families? That's what we'll be discussing today. We'll meet a lawyer parenting 2 children in a same-sex relationship. But first, let's meet Dr. Anthony Hutchinson, who is a social worker and professor who teaches sociology of marriage and the family. Dr. Hutchinson, welcome to the show.
Thank you, Justice Brownstone.
Do you agree with me that same-sex couples are becoming parents at a rate much higher than ever before?
Well, what we see in terms of tracking and monitoring in Canada, where the statistics are quite rigorous across the nation, there is a propensity for same-sex couples to be recognized as couples and to marry increasing percentages based on our census data. Similar data in the United States is more difficult to track because in many states they don't have laws that acknowledge same-sex couples and their rights as people to cohabit.
And so they don't keep track of these couples, but we know they're there.
Absolutely.
And they seem to be having children far more frequently than when I was a young adult.
Well, it's a matter of the measurement. When we pay closer attention to facts, social facts in society, then it would appear that numbers begin to increase. What we do know is that same-sex couples in Canada, for example, are about 0.8% of our population. So there's roughly about 75,000 same-sex couples across Canada out of the millions of families that we have, and we know that roughly about 10% of those same-sex couples generally have children. Sometimes those children were pre-existing from previous relationships, right. But what we also know is that women tend to be 5 times more likely to have children in the relationship, in the same-sex relationship, compared to, let's say, gay men. But we know that same-sex relationships are roughly split, about maybe 60-40 in favor of men.
Can you just take us through very briefly, what are the reproductive technologies that exist out there for same-sex couples to have children?
What we understand is that things like adoption, assisted fertility in the form of donor insemination tend to be technologies that are accessible to both same-sex couples as well as heterosexual or traditional couples, as they're coined. But one of the things that there still is a stigma around same-sex couples accessing such technologies. In 1997, the legal case in Alberta of Mrs. T, for example, who successfully parented 17 foster children. The minute that her lifestyle was deemed to be a same-sex lifestyle from its previous heterosexual lifestyle, she was ruled to be an unfit mother when she wanted to adopt. And so that same stigma and double standard still seems to be pervasive despite the legality of same-sex marriage across Canada from July 2005, and then even in some of the American states where it is legal in the United States.
Now, what does the research say about children who are raised by a lesbian couple or gay men?
Right.
How do these children turn out? Is there a higher likelihood that the children will be gay?
Well, I think what we have to understand is that it really is about people. Using labels such as same-sex versus straight does have implications for identity, but people are people. And what the evidence shows is if a child is being raised in a loving, accepting, caring family by a loving, caring, accepting individual, parent, that's what's most important. For example, when we look at child welfare agency data across Canada, the majority of cases of dysfunctional children and children gone awry are coming from straight parents. There's very few child safety or investigation matters where the parents were deemed to ever have been gay or same-sex couples. So what we understand is that it's really about the relationship between the parent and the child, and that's what we need to be looking at. How loving, how caring, how accepting is that child? And when we look at the data around self-esteem, functionality of the child in terms of performance in school, functionality at home, in terms of how the child feels loved and accepted. All of the data shows it does not matter whether or not the child was raised by a same-sex couple or a straight couple. All that matters is, does the child feel loved, safe, and accepted?
But I think you're talking about how emotionally healthy that child will be, how high achieving the child will be, how able to function in society. But what about the sexual orientation? I think a lot of people still think that if a child is raised by two women or two men, that child has a higher likelihood of turning out gay than if that child were raised by a heterosexual couple.
There's very, very good social scientific evidence that's very balanced in terms of methodology, and what it basically demonstrates is that there's no greater likelihood of a child becoming, let's say, gay if they have same-sex or straight parents. Homosexuality is not passed on genetically. There's absolutely no evidence to indicate that. What the evidence does overwhelmingly show is that gay children are typically born from straight parents.
That's true for every gay person I know. They were raised by straight people, not gay people. We're going to take a break, and when we come back, more with Dr. Anthony Hutchinson. Stay with us. Welcome back to our discussion of same-sex parenting with our guest, Dr. Anthony Hutchinson. Dr. Hutchinson, you teach a course in college about the sociology of relationships, correct?
Yeah, the sociology of marriage and the family.
And you cover the same-sex relationships in your course.
Yeah, we address same-sex parenting as well as all different modalities of family life.
Now, you don't self-identify as a gay man. What interests you in this topic?
What interests me are people, and I think that all people have a right to self-determination, to be who they are, and most importantly, every human being has a capacity and a need and a propensity to love and to care for other human beings. And that's what I'm interested in exploring. What is the love, acceptance, and caring dynamics that we as human beings share with each other and with our children?
What about the mentality out there that says that it's simply not healthy for children to be raised by gay parents? They will be stigmatized at school. There's such cruelty going on. There's bullying. That these kids will not have a balanced upbringing because of the cruelty of others. Not that the parents are bad, but others will stigmatize them.
What we see is that bullying occurs for a plethora of reasons. And if it's not going to be because of who a child's parents are, it's going to be for another reason. For example, if a child has a parent who's a police officer, maybe that child will be bullied and harassed because their parent's a police officer. If their parent is a newcomer to Canada or a newcomer to the United States as an immigrant, they could be equally bullied. So what we see is that we can't scapegoat any person in and across our society for a reason to bully children or to look at what their sexual orientation is. But what the research shows about same-sex parenting in particular is the fact that there's no greater propensity of a child who's raised by a same-sex parent versus a straight parent to be any less happy or any less dysfunctional or have a self-esteem issue. What's most critical and vital for any child, regardless of who the parent is that child loved, cared, raised in a safe environment, and being treated with everything that a child needs to be healthy within their life.
So it seems to me then that children who are raised in same-sex relationships have some challenges, though, because I would think, for example, if I were raised by two women,
yes,
when Father's Day comes along, that's got to be a difficult day for me as a child, wouldn't it?
Well,
you know what I mean? If my father was an anonymous donor,
yes,
at what point and in what way do I find out as a child,
yes,
how I came to being? That's not the same thing as what a child would would go through if there's a mom and dad in the house.
Many of the phenomenon that shape us as a society are socially constructed, and this is what the vital point is. And if we have a true society that's premised on things of education and knowledge awareness, and then we could get away from some of the stigmatization that comes from the kind of victim blaming social beliefs that we have across our society. And that's what's important, because what happens is we do maybe have children who feel left out, but it's not because they're any different, but it's because of what society teaches. So it's very, very important for us to give messages of love, acceptance, and to our children. And many people talk about tolerance. I'm a proponent of acceptance versus tolerance.
Right.
And that's something to be equally applied to, let's say, the children of same-sex parents as to newcomers to Canada. There's absolutely no difference.
And I
that's
would say,
one of the things we have to focus on.
There are lots of kids who don't have fathers, and Father's Day is difficult for them for other reasons.
Absolutely. And when we look at lone parent families, they don't have fathers
or mothers.
Or mothers in some cases. So we have to be very, very cautious how we're applying labels and how we're feeling our children in terms of making them feel isolated or marginalized. We need the mandate is broader than just saying, is it a same-sex parent or a straight parent? It's really about, is it a loved, cared for child in a safe environment?
Do you know if there are any studies that deal with these grown-up kids who have no identifiable father because their father was an anonymous donor? Mm-hmm. Is there any research that shows how they cope with that? Because it's natural human curiosity to want to know who your parents were.
Right.
I mean, children that were adopted very often look for their birth parents.
Yeah, I mean, I do a lot of work in fatherlessness, especially with marginalized young men who get involved in gang activity, and there's definitely a need for, let's say, having positive role models. But that's the key: positive role models. It's not whether it's a male or a female role model; it's whether it's a positive one, and if the experience for the child is loving, caring, and functional. Because just to say it's about fatherlessness or not knowing who the parent is, that could be counterintuitive, because what if it's a dysfunctional parent, or what if it's a violent or abusive parent?
Well, that would be worse.
That's right.
But isn't it true that a young boy needs a male role model in their life? It may not be a parent, could be a grandparent or an uncle, and that a young girl would need a female role model in her life?
But what the evidence shows is the role model need not be a parent. The role model may only need to be a functional, healthy person. In my life, as a gang-involved young person, the person who was one of two men who was absolutely critical in my life in shaping me to be the person who I was a gay atheist teacher.
A gay atheist teacher?
Yes, right, and along with a Christian male youth worker.
And I was hoping it would be a judge.
Well, I did have a good experience with a judge later in life. But my point is, it wasn't about whether the person had a faith orientation or whether they didn't believe in a God.
Or even whether they were family.
Or even whether they were family. They were both male, they both came from different spectrums, but they both showed me concern, genuineness, and authenticity.
And obviously cared about you a lot. Thank you very much for being on the show, Dr. Hutchinson.
Thank you.